انت ارجي الجميع مثلا حط بالعربي وبالانجليزي.
ترضيف وحاضر. هلا الدكتور يتكلم عن موضوع الانجاب وضرب الانجاب او مشاكل الانجاب. هحاول اوصل يعني في الاخر احط شيء 6-7 محاور واتكلم فيها بس يخلص.
بس من الاحوال زي عشان الاوزون
الاوزون حاضر. الدسكشن حاضر. ما يهمك ما يهمك.
Despite the fact that conventional medicine and IVF, IUI is performing in the most cases of the infertile women, infertility remains a very common problem in the world. The modern therapies such as IVF and IUI overall have a little success, as low as 20% of the success rate. The case of the infertility is not in the most cases not clear or unexplained. In allopathy medicine, there is a proper diagnosis and treatment. Despite too much attention to the evolution and fertilizing them artificially, but little work is done preparing the patient body. How they prepare the patient body in TCM, traditional Chinese medicine. In TCM, achieving by so-called harmony of yin and yang, qi and blood is one of the main aim of the Chinese medicine. Everybody knows about the yin and yang, and blood and qi. Totally, when we are talking about the qi, there is a vital energy that circulating the blood tract and meridians. And there is a new shape yin and yang. Combined with the blood is a main part of the body that when it is not harmony together, so it will make disease. The basic theory in the infertility in TCM, according to the Chinese medicine, the reproductive system of human being are mainly controlled by kidneys. That is, cannot see in the Western medicine. The kidney is one of the main organs in infertility. The quality and quantity of ovulation and the sperm are dominated by kidney essence. It calls Jing or Jing Qi. The better Jing causes the better ovulation and eggs and the sperms. The cause of infertility. What is the cause of infertility? Anything affecting of the weakening of the kidney and blood and uterus will cause infertility in women. The following are the most common cause. 1, genetic defect or weakness. Second, overconsumption of the qi, blood or jing, such as working so hard, not resting too long without enough rest, heavy menstrual bleeding, or too much sexual activities. That all affect of qi, blood and jing. Emotional stagnation, such as long-term depression. Improper diet. In some cases, there is nothing to eat, or sometimes lack of a wide range of diet. Some medicine can cause damage to the kidney, or they will be weakening the reproduction system. Like contraceptive pills, if it is used too much, it will be cause of one of the problems for the infertility. Wrong or unnecessary treatment like DNC performing in the many young girls, it can cause sometimes a form of infertility and damage to the lining of the uterus. How TCM diagnose infertility? According to the patient clinical data, particularly in information about the menstruation cycle, usually infertility divided in 5 categories. First category is kidney deficiency. In this case of patient, scanty menstruation, bleeding, thin blood, weak back, tiredness, feeling too cold or too hot, especially in the night. That is because of the kidney deficiency. The other one is liver qi stagnation. Painful and irregular menstruation, lots of premenstrual tension is due to liver stagnation. Other one is dampness and phlegm blocking. In this case of patient, lack of menstruation bleeding, more charging on the mucus, discharging too much, often over the joint and feeling heaviness of the body. That is dampness and flame of blockage. The other one, blood deficiency. In this case of patient, a scanty menstrual bleeding with pale blood, tiredness and sallow complexion. These people always feel cold, weakness, dizziness, and face is pale, and blood stagnation. In this case of the patient, very painful menstruation with dark clots can see it. So, how we can use integrative medicine to treat infertility in traditional Chinese medicine? For the kidney deficiency, first we'll use some prescription. In this kind of the disease, the best medicine that we can use it is first Renshen ginseng, because most of this medicine is in Chinese, and when you are prescribed, if you write only pronunciation of this Chinese word, most of the Chinese pharmacists they know, but when you are writing the Western name, or most of them is a Yunani name, it is not very clear for all the doctors. So I'm writing Chinese name. Bai Zhu, Fulin, Bai Xiaoyao, Gan Cao, Dangui, Shen Du Huang, Shu Di Huang, Du Zi Si, Wu Zhong, Lu Jiao, Chuan Jiao. This is very good medicine for the kidney deficiency. In acupuncture, we are stimulating the Shen Shu, Guan Yuan, San Yin Jiao, Yu San Li, Ran Gu, and Qi Xue. According to the standard name, BL23, CV4, SP6, but in Chinese name, it's very important because Chinese name is different from the Western name for the acupuncture. For example, BL bladder 23, Shen Shu. Shen means kidney, Shu means point. So it's very, very clear when we are talking in Chinese. Or San Yin Jiao, because San means 3, Yin means in channels, and Jiao means crossing. So 3 of in channels crossing together. So this name, you will never forget it. But when you are talking about 1, 2, 3, or any international standard name, it's very easy to forget it. So most of the time we are using the Chinese name, and it's very effective, and you are not forgetting anymore, if you practice in long time. When liver chest stagnation,
Chinese water.
yeah. In liver chest stagnation, we are using Dangui, Baizhu, Bai Xiaoyao, Fulin, Danpi, Xiangfu, Ganghuafeng. There is a very special medicine in Chinese. The name is Dangui. Dangui in Angelica sinensis. Why they are calling Dangui? Most of the doctors maybe they don't know about this medicine. This medicine is mostly used in OB/GYN medicine and for the infertility and many cases of the women's disease. Dang means the time, Gui means must return, means supposed to return. Return what? Return the circulation, return the fertility. And this mostly, when they are using, the abnormal circulation will be returned back. But there is a story about the Dangui. One day, a Chinese man married with a girl, but this man is wife is not fertile, and he promised to go and bring some medicine for her, and promised if after 3 years I didn't came back, we can marry with other. When he came back, this lady already married with the other man, and still there is a infertility. So she gave this medicine to her. Immediately after 1 week, the disease is disappear and menstruation is returned back. So they call Dangui, and this medicine is always in China. They are using for infertility in traditional Chinese medicine. And acupuncture for liver qi, we are using Zhongji, Semen Shui, Tai Chong, Qi Shui, Yang Li Chuan, and San Jiao. So in dampness and phlegm stagnation, herbal prescription is Fabanchi, Changzhu, Xiangfu, Shenchu, Fuling, Chenpi, Chuanxiong, and acupuncture is Zhongji, Sanxing, Fanglong, Sanninjiao, and Yinlichua. In blood deficiency also we use Dangui, Chuanxiong, Shanyao, Shujihuang. In acupuncture, ST36 or Zusani, Qihai, Sanninjiao, Yinlichua, and Pichu. In blood stagnation, we are using Dangui, Shenyihuang, Taoren, Honghua, Zheke, Xishaoyao, Chaihu, Gangcao, Jiegong, and Chuanxiong, Niu Xi. And acupuncture, Zhongji, Huilai, Sanninjiao, Qishui. So special acupuncture and observation. That we talk about the acupuncture, the point that we are using is many condition is different, but very common points and very important points that we have a successful rate in many cases of the infertile ladies. We did is we are using in the abdomen, especially in Renmai, we are using for 6 months, 2 times per week, and we are using 2 to 1 inch needle, inserting for 20 minutes in these points. This is very, very important in acupuncture. We are, we are using the odd days and even days, first we are using the acupuncture in a red one, the other day is we are using the green one, stimulating for 20 minutes. Then we can using this moxa stick, putting this device. This device can put on the abdomen and hitting the area, especially between under the umbilical. This area is very sensitive for the ovulation and increasing the uterus blood circulation. It can increase about 20%. The origin of the IVF is 20%. With this device, it can increase in about 40%. So this situation is easy, but is a little higher for the patient. But the stimulation is very good, and we can use combination of heating, electroacupuncture, and cupping. Cupping, we are using the REM meridian, but after the cupping, we can using the stimulation by the 20 minutes and heating by 20 minutes. So this situation is very important for infertility. Combined with the herbal medicine or sometimes allopathic medicine can increase the treatment of the infertility rate. Thank you very much.
Thank you. Is there anybody want to translate in Arabic, or it's clear for you?
Can I just ask a question?
Okay, دكتورة تفضلي.
In this treatment, do you thread the needle, or you just put it in its
No,
position?
we are inserting the needle according to the area. Neither they have the same situation with inserting.
Okay.
Yes, it's not deeply. It is inserted top and
So you thread it.
and it's 15 degree. Each needle is 15 degree will go. Yeah. The red one with red one, green one with green one.
But my question, you're threading it towards the CV8?
You know, yes, towards the umbilicus, yes. Yeah. This same method is increasing the uterus circulation, also increasing the linear of the uterus, endometrium. In some cases, there is a lack of endometrium. This is the best treatment for the increasing the endometrium.
حدا من الحضور بده يعطيني بريف بالعربي عن المحاضرة ولا خلاص الأمور واضحة؟ Okay. Thank you, Dr. Thank you.